Hello, my name is Dr. Julie Byerley, and I am president of the Geisinger College of Health Sciences. I serve as the chair of the Health and Healthcare Task Force at the Institute. This year's study looks at the critical role that Medicaid plays in community wellness. Approximately 750,000 Pennsylvanians receive health care through Medicaid expansion, and since 2015, more than 2.5 million residents have gained coverage at some point as a result of the program. As of 2023, hospital uncompensated care costs are 27.7% lower than they were before Medicaid expansion, even as overall healthcare costs have risen. Medicaid is a foundational pillar of the American healthcare system. It provides essential coverage for individuals with low income, disabilities, or other qualifying circumstances. It also provides more than health insurance. It stabilizes hospitals, reduces uncompensated care, and supports long-term care and rural health systems. Since Pennsylvania expanded Medicaid in 2015, more than 2.5 million residents have gained coverage at some point, and hospitals have seen uncompensated care costs fall by nearly 28%, even as overall health care spending has risen. The passage of the federal H.R. 1 budget reconciliation bill introduced changes to Medicaid that will unfold over several years. These changes were designed to achieve substantial budgetary savings at the federal level, nearly $1 trillion over the next decade, by slowing the growth of Medicaid spending. Changes of this scale inevitably carry implications for states, for healthcare providers, for communities, and for individuals who depend on the program. This report does not assess the merits of the federal fiscal objectives, but instead focuses on how the resulting policy changes may affect health coverage, access to care, and system capacity at the regional level. By outlining anticipated changes and potential downstream effects, this analysis is intended to support planning, inform decision-making, and help stakeholders identify opportunities to mitigate unintended health and economic impacts associated with the reprioritization of federal resources. One of the most significant changes involves mandatory work requirements for adults eligible through Pennsylvania's Medicaid expansion. By 2027, states must verify employment or qualifying activities every 6 months. Evidence from past implementation suggests that most coverage losses will stem not from unemployment, but from administrative challenges such as missed deadlines, complex paperwork, and confusion about reporting requirements. Additional changes include shorter retroactive coverage periods, quarterly verification checks, reduced home equity thresholds, and new co-payments for certain expansion group adults. Federal funding for many lawfully present non-citizens will also be reduced, affecting access to essential services and increasing the potential for immigrants to avoid seeking care. These policy changes are projected to increase the number of uninsured people nationally by 7.5 million by 2035. That includes 310,000 Pennsylvanians. Despite these challenges, the policy shifts also create some targeted opportunities. The expansion of the Section 1915C waiver option, beginning in 2028, will allow states to broaden access to home and community-based services. This change could help individuals with long-term care needs remain in their homes, improve their quality of life, and reduce reliance on more costly institutional care. Additionally, the Rural Health Transformation Fund, established in 2025, offers $50 billion to strengthen rural health systems across America. These dollars may support workforce recruitment, telehealth capabilities, chronic disease management, and partnerships that stabilize rural hospitals. While temporary, this funding provides a vital lifeline to rural areas already facing provider shortages. Medicaid changes will reshape healthcare coverage, workforce dynamics, and financial stability across Pennsylvania. Providers, policymakers, and community leaders must take proactive steps to safeguard coverage and reduce disruption. Recommendations include embedding screening and referral protocols into clinical workflows to identify individuals at risk of losing their coverage, offering on-site assistance, including navigators and multilingual resources to help people meet the new reporting and eligibility requirements, strengthening pathways to qualifying work and community engagement activities through partnerships with workforce agencies, employers, and community colleges, leveraging rural health transformation funding to stabilize essential services, developing financial resiliency plans that anticipate these changes in reimbursement and uncompensated care, prioritizing data collection to monitor enrollment patterns, service disruptions, and emerging population needs. Through coordinated planning, cross-sector collaboration, and strategic support for vulnerable populations, we can better navigate these changes and work to preserve the essential role Medicaid plays in northeastern Pennsylvania. Thank you.